Behind the locked doors of the American penal system, a preventable death occurs with chilling regularity, not from violence, but from a calculated denial of basic medical care. Imagine a patient pleading for a doctor as an infection spreads, only to receive a single ibuprofen from a corporate contractor whose profit margin depends entirely on that exact denial. This is the grim reality of privatized healthcare within the private prison industrial complex, a vast network of corporations and contractors that profit from mass incarceration. For decades, private healthcare companies have pitched a seductive promise to state governments, offering cost-effective medical care that supposedly relieves the massive financial burden on taxpayers. Yet, the financial architecture of these contracts incentivizes the exact opposite of patient well-being. Companies are often paid a flat per-inmate fee, meaning every denied test, delayed specialist visit, and understaffed clinic directly translates to higher corporate earnings at the end of the fiscal quarter. The shift toward this model accelerated in the late 20th century as the carceral state, the expansive system of law enforcement, courts, and prisons, swelled beyond government capacity. State legislatures, desperate to slash budgets, turned to the private sector, creating a captive market where the patients have absolutely no choice of provider and zero leverage over their own health. To secure these lucrative monopolies, corporate entities deployed aggressive lobbying, the act of attempting to influence decisions made by government officials, ensuring that oversight remained minimal and contract renewals remained virtually automatic. Millions of dollars flowed into political action campaigns, masking the catastrophic failures unfolding behind razor wire. Two dominant players emerged in this shadowy marketplace: Corizon Health and Wexford Health Sources. According to documented reports, these corporations amassed over $1.2 billion in annual revenue by securing contracts across dozens of states, promising efficiency while systematically hollowing out medical infrastructure. The human toll of this efficiency is staggering. Documented evidence reveals a pattern of agonizing delays where inmates with treatable conditions like asthma, diabetes, or early-stage cancer are left to deteriorate until emergency intervention is unavoidable, or worse, no longer viable. When these tragedies occur, the corporate response is rarely a structural overhaul. Instead, internal audits are buried, staffing logs are heavily redacted, and the narrative is carefully managed by legal teams to isolate incidents as tragic anomalies rather than systemic features of the business model. The Arizona prison system serves as a harrowing case study of this mechanism in action. In 2012, the state awarded a massive contract to privatize its prison healthcare, a decision that experts contend led to an immediate and catastrophic decline in medical services across the state. Within months, reports leaked of chronic understaffing, where medical personnel were stretched so thin that routine medication distribution became chaotic and dangerously inconsistent. Whistleblowers described facilities where basic sanitation protocols were abandoned simply to cut overhead costs and maximize shareholder returns. The crisis in Arizona culminated in a landmark class action lawsuit, exposing a system where inmates were routinely denied life-saving care. Court documents detailed specific cases of delayed diagnoses and denied emergency treatments that directly resulted in preventable fatalities, painting a picture of deliberate institutional neglect. Yet the echoes of those early deals resonated far beyond the courtroom. Even when faced with massive fines and legal settlements, the corporate entities calculated these penalties as a mere cost of doing business, a tiny fraction of the profits extracted from the state. This calculation reveals a chilling truth about inmate medical neglect. When the financial penalty for a wrongful death is less than the cost of providing adequate preventative care across a prison population, the corporate mandate dictates that the neglect must and will continue. Lawmakers occasionally feign outrage, holding public hearings that produce sternly worded reports and minor contractual tweaks. However, the underlying incentive structure remains entirely untouched, preserved by the quiet lobbying efforts that fuel systemic vulnerabilities. To shield themselves from mounting liabilities, some corporations have employed aggressive and controversial legal maneuvers. A prime example is the bankruptcy tactic known as the Texas two-step, where a company splits into two entities, offloading all legal liabilities onto one while the other continues to operate and generate profit unhindered. Corizon Health, facing a tidal wave of malpractice lawsuits and civil rights claims, utilized a variation of this strategy. By filing for bankruptcy under a newly created shell company, they effectively froze hundreds of lawsuits filed by incarcerated individuals and their families, denying them their day in court. This legal shield translates directly to profound suffering on the cell block. A mother fighting for answers about her son's death from an untreated ulcer finds her pursuit of justice completely stonewalled by a corporate restructuring designed explicitly to evade accountability. Legal scholars and human rights advocates argue that this maneuver weaponizes the bankruptcy code against the most vulnerable population in the country. Experts contend that allowing private healthcare companies to discharge their liability for constitutional violations sets a highly dangerous precedent for corporate impunity. Meanwhile, companies like Wexford Health Sources have faced their own intense scrutiny. In states like Illinois, documented reports highlighted severe deficiencies in psychiatric care and chronic disease management, painting a picture of a system fundamentally incapable of meeting basic medical standards. The recurring theme across these different corporate actors is the relentless drive to minimize expenses at all costs. Whether it is Corizon or Wexford, the business model relies heavily on hiring underqualified staff, denying expensive specialist referrals, and rationing basic medical supplies. The state governments, ostensibly the regulators of these contracts, are often complicit in the failure. By outsourcing the medical care, they also attempt to outsource the moral and legal responsibility, creating a convenient buffer between elected officials and the dying inmates. This buffer is reinforced by the sheer opacity of the penal system. Prisons are inherently closed environments, making it incredibly difficult for independent journalists or medical watchdogs to verify the claims made by the healthcare providers or to investigate the true extent of the neglect. The historical trajectory of this crisis traces back to the tough-on-crime policies of the 1980s and 1990s, which caused prison populations to explode. As facilities overcrowded, the subsequent strain on medical budgets paved the way for the privatization experiment, an experiment that prioritized fiscal austerity over human life. The policy's lingering effects still loomed over modern criminal justice reform efforts. Even as some states attempt to reduce incarceration rates, the entrenched contracts with private medical providers ensure that the profit extraction continues unabated from those who remain behind bars. The impact extends far beyond the prison walls, deeply affecting recidivism, the tendency of a convicted criminal to reoffend. Individuals released with untreated chronic illnesses or unmanaged severe mental health conditions face insurmountable hurdles in reintegrating into society, often leading to destabilized communities and a vicious cycle of reincarceration. Public health experts contend that prison health is fundamentally community health. When infectious diseases or mental health crises are ignored within the carceral setting, they inevitably spill over into the public sphere upon an inmate's release, placing a massive burden on local emergency rooms and municipal social services. This broader societal cost is entirely externalized by the private healthcare companies. They reap the immediate financial rewards of the state contracts while leaving the long-term medical and social wreckage for everyday taxpayers to subsidize. The mechanisms of justice seem entirely ill-equipped to handle this massive scale of corporate malfeasance. Fines levied by state departments of corrections are often capped or easily absorbed, acting as minor tolls on a highly lucrative highway of systemic exploitation. Furthermore, the competitive bidding process itself is fundamentally flawed. Companies with documented histories of catastrophic failures in one state simply cross borders, submitting low-ball bids to win contracts in another, continually outrunning their own disastrous records. The cycle of neglect and renewal is starkly visible in the data. Contract renewals are frequently approved despite glaring audit failures, suggesting a deep systemic inertia where the convenience of a turnkey private provider outweighs the constitutional mandate to provide adequate care. To maintain this illusion of adequacy, corporate public relations teams deploy highly sophisticated messaging. They highlight isolated success stories or minor technological upgrades, deliberately obfuscating the broader reality of empty clinics, unanswered sick calls, and desperate patients. Behind the polished corporate reports are the voices of the incarcerated, voices that are systematically and ruthlessly silenced. Letters begging for medical intervention are filed away, grievances are dismissed on technicalities, and the physical deterioration of the patient is blamed on pre-existing conditions rather than institutional failure. Civil rights attorneys argue that this constitutes a systemic violation of the Eighth Amendment, which strictly prohibits cruel and unusual punishment. Experts contend that deliberate indifference to serious medical needs is not merely a breach of contract, but a fundamental human rights abuse sanctioned by the state. Despite these constitutional arguments, the legislative appetite for ending privatized prison health care remains incredibly tepid. The shadow of corporate influence still stretches across state legislatures, ensuring that bills aimed at increasing transparency or mandating strict staffing ratios die quietly in committee. The financial imperative is simply too strong to dismantle easily. As long as human beings are commodified as units of revenue, the incentive to provide less care for more profit will remain the driving force behind the hidden system of prison health care. The ultimate tragedy is the normalization of this profound suffering. The public, largely detached from the harsh realities of the penal system, remains largely unaware that their tax dollars are funding a corporate apparatus that actively profits from the agonizing preventable deaths of fellow citizens. The true cost of this model cannot be measured on a corporate balance sheet. It is measured in the silent, preventable tragedies unfolding behind concrete walls, a stark indictment of a system where justice is outsourced, accountability is bankrupted, and human life is deemed an expendable liability in the relentless pursuit of profit.